Welcome to the Endo Kids Podcast, the podcast where we help families navigate the ups and downs and in-betweens of growing up healthy. I'm Dr. Rinku Mehra, the founder of Endo Kids Concierge and a pediatric endocrinologist, and my co-host is Dr. Lindsey Waldman, who is also a board-certified pediatric endocrinologist. We are here to break down the science of hormones, share real stories, and answer the questions parents wonder about the most. So whether you're worried about growth, puberty, thyroid, or just want to understand your child's development a little bit better, you're in the right place. We believe every family deserves answers, support, and a caring partner in their health journey. So grab a cup of coffee, get comfortable, and let's tackle this topic together today. This podcast is for educational purposes only and is not a substitute for medical advice. Please consult your child's healthcare provider for individualized care. Welcome to the Endo Kids Podcast. I'm Dr. Mehra, a pediatric endocrinologist and founder of Endo Kids Concierge. And I have with me today Dr. Waldman, and we are going to talk about growth today and growth hormone in particular. I have a lot of questions in the clinic, as does Dr. Waldman, about growth hormone. And really, this podcast is for parents who want a deeper understanding of their child's growth, hormones, and metabolic health, and beyond what's possible in a standard visit. So we'll walk you through what matters, what to watch for, and when to take action. So, Dr. Waldman, let's talk a little bit about growth hormone, what it is, and who actually needs it.
Absolutely. So when we think about growth hormone and we think about families who might be thinking about their children's growth, a lot of times they get told, let's just wait and see, right? You take your child to the pediatrician, they measure them, they do height and weight. Hopefully you're looking at the growth chart along with them. And again, a lot of times, let's just wait and see is but when it comes to your child's growth, the advice can cost you time that you can't get back. As you're going to hear, time is super important. There is a window of time that we always talk about with growth, and it is really important. So, again, today we're going to be talking about growth hormone, what it is, what it actually does, and the truth about who really needs it.
We want to simplify a little bit about what growth hormone is. So, in simple terms, growth hormone is a hormone that your child already makes. So, it comes from the brain, it comes from a small gland called the pituitary. I think we've talked about that before. And the job of growth hormone is to signal the body to grow, to build, and to develop. So it works through something called IGF-1, and think of IGF-1 as like the messenger. So growth hormone that's again made in the brain tells IGF-1, which is the messenger, what to do, and IGF-1 actually makes the bones grow.
And you might have heard about IGF-1 because that is what we first measure when your child gets blood work. And we'll talk about this, of course, but you might have heard that when we've talked about growth in the past. Now, growth hormone, again, doesn't directly grow bones. It signals the system that does. So again, what does it do in the body? Growth hormone is not just about height, right? You hear growth hormone and you think, that's to make kids tall. But even us as adults, we know growth. We need growth hormone. It affects bone growth, muscle development, fat metabolism, and energy levels. And I certainly know that I want my growth hormone to work for all of those things, not necessarily to get taller, unfortunately, but for all of those other things. So it is important all throughout life. Kids with low growth hormone may look younger than their actual chronologic age. They might have lower muscle tone and they might tire more easily. Now, again, there's a lot of different factors that can go into all of those symptoms. So it might not be growth hormone, but certainly growth hormone can play a factor. And we know that this is not purely cosmetic. So sometimes when people come in worried about their kids' growth, sometimes there's maybe some shame in there, but again, it is not just the cosmetic factor. It is really important. It is physiological.
So, we get a lot of questions about who actually needs growth hormone and actually have a lot of consults about growth hormone. And so I want to break down about who actually needs growth hormone because I will say that sometimes this diagnosis is missed. So, but not every child needs growth hormone. Okay. And let me say that one more time. Not every child needs growth hormone. There are real indications for growth hormone, and there are FDA approved indications for growth hormone that we as pediatric endocrinologists have been trained to evaluate. Okay. So we have talked about our training and how many years of training we've done after our pediatric residency. So we've had 3 years of fellowship training, and then we've been seeing patients for many, many years and evaluating them for growth. The real indications for growth hormone are growth hormone deficiency. So obviously, if there is a child that is not making enough growth hormone, so their pituitary is not making enough growth hormone, they have a deficiency and they need growth hormone to grow. And for some of the other things that we talked about, there are medical conditions like Turner syndrome, which we will talk about in future episodes, that the children with these conditions need treatment for growth hormone. Kids with chronic kidney disease, kids who are small for gestational age. So if you had a baby that was small when they were born and they did not catch up by the time that they were two, that is an FDA approved indication for growth hormone. One that we talk about a lot is idiopathic short stature. So idiopathic means we have evaluated for every reason that a child may not grow, or every reason that we know of that a child may not grow, and they still are not growing well. And in select cases, children with idiopathic short stature can receive growth hormone. This is an FDA approved indication as well.
Yes. And when we think about idiopathic short stature, there are definitions of what that means, right? So there's a specific height percentile that you need to be in order to meet those definitions. So it's not just necessarily a quote, shorter child. There are specific definitions. So it's really important to remember all of these. And the other thing to remember is short does not equal abnormal, but some short children are being missed, right? There are a lot of children that are on the lower end of the percentiles that are perfectly happy, healthy, and fine, and are going to grow up to be wonderful, healthy adults. But there are some children that are not growing well and really do have problems. And that's where we want to talk about what some doctors can miss. Your general pediatrician is wonderful. They're looking at your child from head to toe, making that they're healthy, that school is going well, that their mental health is fantastic. But there are some things that can be missed. Most visits are super short, right? They might be 10 to 15 minutes long, which a lot of times is just not long enough to evaluate the whole child when certain things might be wrong. They do a quick height check, right? Sometimes it might be someone else who is checking your child's height. Maybe your child is a little bit wiggly. Maybe they're not standing as tall as they should be. And sometimes you might just get reassurance of things look fine, everything's fine, and kind of move on. If you're worried about height, it is really important to track growth. So you want to track your child's growth and you want to make sure it's a good growth, right? That is something that I learned very early on in my training. You want to make sure that you're getting a very good height for your child, meaning your child is standing tall and straight, their knees are straight, they're not bent, their head is not tilted up, down, all around. And so you want to make sure that you're getting growth that you can monitor. And so you can monitor their velocity, their speed of growth. A lot of times that's not happening. Also, once you're to that step where you're worried, maybe thinking about something like a bone age x ray, looking at an x ray of the left hand and seeing how old in comparison to the chronologic age the bones are and how much time you have left for growth. And certainly looking into hormones if it gets to that point. So, looking into the pattern of hormones that we might be curious about if we are worried about growth.
Yeah, and I think it's important. I mean, we've mentioned this so many times in the podcast, and we've also mentioned this in the office if you've come to see us, but really growth is just not one measurement. Okay. It's a pattern over time. And I know we said in the beginning, that timing is of the essence. We don't have a lot of time for kids to grow, but just one measurement of growth really doesn't help us too much. So, really, what we want to do is look at a pattern over time. Often it's 6 months, at least 6 months that we're looking at to see how a child is growing because growth hormone deficiency can present itself, within the first, within 6 months, or it may take a little bit longer. So really it's important for us to look at what the pattern is for growth. So I think that's very important to emphasize and for all our patients. I mean, I know that I have had people actually get upset with me in the clinic when I have said maybe come back in 6 months for an evaluation. That they have said, we've been waiting for years. Why do we have to wait another 6 months? And, if we feel like something is urgent, we'll let you know right away. But oftentimes I do like to look at kids, in 6 month intervals just to see how they're growing because sometimes, interestingly, kids do grow a little faster sometimes in the summer than in the winter. And so it's good to get, have a pattern to look at. But the next thing we really want to talk about, and we get these questions a lot in the clinic, so we wanted to break it down and have another resource for our patients as well. But growth hormone, how is it given? Dr. Waldman, let's talk about the part that parents worry about, which is injections. So growth hormone is given by injections, and let's talk about that a little bit.
Yeah. And so, unfortunately, there is at this time no oral medication, nothing that you can swallow that's going to give growth hormone. It is only given as injections. And just like Dr. Mehra said, that can cause a lot of anxiety or for families, even before knowing if you need growth hormone. Sometimes they will walk in before even getting evaluated talking about the injections. And so, we want to talk about what it means and how to give it. So, again, it is given either once a day or once a week. We'll talk about that. And it is given with a very, very small needle, very, very tiny. And I will say that the overwhelming majority, the exceedingly almost every child that I've ever started on growth hormone does really well. There is a lot of anxiety at the beginning. And after they figure out that it really doesn't hurt, that it's not such a big deal, they do so well with it. It becomes part of their routine, just like brushing your teeth. It's time for your medicine. All right, here's my arm, here's my leg, here's my belly. Let's just get this over with. And then they move on with the rest of their day or their evening whenever it's given. So, again, it is given as an injection, but it is a teeny tiny needle. It is very easy to give. And the kids, like I said, just adjust very quickly and it becomes part of their routine.
So a lot of times patients are seeing the results of it and they, want to take it every day and help them, have it help them grow. We do have information now and availability of weekly growth hormone. Okay, so let's address the question that I get all the time about what about the weekly shot? And is my child eligible? And what do you think about it? And yes, there are now weekly growth hormone options. I will say that a lot of it is also dictated by the insurance as far as what they will approve. So they don't always approve it, but there are weekly growth hormone shots. And are they effective? In many cases, yes. The data shows that it's comparable to the daily shots, and that kids are growing just as well. And it's once a week. What really we have data on is that daily growth hormone shots, we have, decades of data on daily growth hormone shots. And sometimes there's a little bit more flexibility. We can titrate the doses a little bit easier. But the weekly growth hormone shots are newer, they're more convenient, they're available, and they do show that helping kids grow. And kids sometimes are, needle phobic or they don't want to have a daily shot. And so the weekly shot may be the right option for them. Okay, the best option is really not the easiest. It's really what's most appropriate for your child. And then again, the insurance coverage is also really important. Some kids are great candidates for weekly shots, others aren't. So it really isn't, one size fits all. I've had some kids tell me the weekly shot hurts more than the daily shot. And so I think that's just important to assess. But certainly talk to us at the visit or talk to your pediatric endocrinologist if you have one about what's the most important thing for your child. I want to talk a little bit about side effects. Okay. So people are also just as much anxiety as parents have about the shots themselves, they're also nervous about side effects. So Dr. Waldman, let's talk a little bit about side effects of growth hormone and what do you tell your patient?
Sure. Just like any medication, there are always possible side effects. And that is something to understand and to ask questions about if you have questions about it, right? There's nothing that comes without possible side effects. I will say that most of the possible side effects are very mild and they are very rare. I have been very lucky. And in the, again, overwhelming majority of my patients, they do super well. I do not see side effects, but there is always that potential. And we always want to talk about them. So, one of the first side effects, of course, is injection site discomfort. So it is an injection, like we said, it's a teeny needle, but there always can be some discomfort, some redness at the site of the injection. So you always want to watch, make sure everything's okay a few days later, wherever you gave that growth hormone. There are some kids that can develop headaches early on, not everybody, but these headaches can be significant. They can be different than typical headaches. And if that happens, you certainly want to talk to your pediatric endocrinologist about that. You even might want to stop the growth hormone for a period of time. Again, this is a rare possible side effect. You can get some joint pains when you first start or hip pain, and this can actually be pretty significant hip pain and even be somewhat of an emergency. Again, this is very, very rare. You can get some increased pressure in the brain, again, causing these possible headaches. These are very rare things, but certainly can happen. Growth hormone also can raise your blood sugar while you're on it, not to the point of diabetes, but your own growth hormone that you are making raises your blood sugar. So growth hormone that you give can also raise blood sugar. I myself, everyone is different, but when I'm following someone who is on growth hormone, I usually like for them to get blood work about twice a year. And I do like to do that bone age x-ray about once a year. Again, every child is different, so this can change. And every prescriber, doctor is different, so that can change also. But this is kind of how I follow my patients along with their growth, of course, seeing them in the office and watching their growth velocity. But I'm looking for possible side effects when I'm seeing them in the blood work, et cetera. Is there anything else you tell them, Dr. Mehra?
Yeah, I mean, those are the main side effects I talk about. I have had probably about 3 patients throughout my career that have developed scoliosis from the growth hormone. And usually I would say that's a rare side effect. Usually it's in patients who are predisposed to get scoliosis. I think one of my patients had Noonan syndrome, which we'll talk about in a later episode. And the other 2 patients I had were brothers who also had a genetic defect in their growth hormone receptor, and they also developed they developed scoliosis, which was pretty mild. But I always talk to patients because of it that, you can develop a mild scoliosis similar to the hip issue that you have because, growth hormone causes the body to grow symmetric. So it's not like one side of the body grows faster than the other. Okay. But sometimes the spine can't keep up with how fast the rest of the body is growing. So I do monitor my patients for scoliosis and I haven't, really had anybody else. But I always like to tell, parents that I check that at every visit. Also, if they have any hip pain or knee pain, the hip joint also can't keep up with how fast the rest of the body grows. So that's why I also ask, parents to keep an eye on that. But usually the side effects are pretty minimal. But growth hormone is safe when used appropriately, but it's not a casual medication. It's not something that you could just buy online or take, for your child. So it really needs close monitoring, careful monitoring, and also an evaluation of the growth rate. I mean, if a child is growing too fast, especially during puberty, sometimes I see that with the growth hormone, the child is growing rapidly. Or like you said, I'll do lab work and I see that the growth hormone levels are increasing and I'll actually cut back on the growth hormone. So it really does require monitoring by someone who is very specialized in looking at it and has experience in giving growth hormone.
I think those are really important factors, especially the one that you mentioned about getting it maybe off the internet, right? To me, that is an extremely scary situation to think about that someone is getting medication. First of all, do you know what you're getting? That's my first question. But maybe it is growth hormone, but not being followed by someone who has training in that is a very scary situation to me. There, again, we said the side effects are but they're absolutely possible. And it makes me very nervous for someone to be taking a medication without being followed correctly. So I think it is super important that if you are worried, if you are wanting to be on growth hormone to talk about growth, you find someone who is trained and can do that with you. And when we think about that, right? When we think about those visits, getting evaluated for growth, thinking about growth hormone, we think about these decision making because it is a big deal. It is a big decision for parents, guardians to make whether they want to start their child on growth hormone if they have, again, an FDA-approved indication. And as a parent, before starting, you want to ask again, what is the diagnosis? What are we treating here? What is the expected benefit? Now, sometimes we don't necessarily know exactly how much benefit you're going to get, but talking about that with your doctor is really important. What happens if we wait? What are the pros and cons? Because all of these things play into making that decision. It is a shared decision between the family and the doctor. That's how I feel.
Yeah, I absolutely agree with that. And the other thing I just wanted to add is that growth hormone is given for some of the indications that we talked about. But the other thing I want to make clear is that growth hormone can really only be given if there is room for the child to grow. Okay, so if we do a bone age and the bone age shows that the growth plates are closed, okay, or that there's no more room to grow, and for a boy, typically around 16 is, when we see that for a girl around 14, I have a lot of people ask about giving growth hormone anyways. And I just want to make it clear that patients who have a bone age of 16 or, for a boy or a bone age of 14 for a girl usually don't have any benefit from growth hormone. And actually the risk of side effects is much higher on those patients without any reward. So, we are both, pediatricians, we're moms, and also, we have a lot of experience in evaluating patients for growth and growth hormone. And it's very important to understand that we will not give growth hormone when it increases risk, but it could potentially cause a harm. So I think that's very important for patients to understand. We do give growth hormone. I have prescribed it, quite a bit throughout my career, but we do evaluate. So if your child is following behind in growth, they're not following their curve, and you want data and you want to have some experience look at them, we'd be happy to see your child because at Endo Kids Concierge, we evaluate growth patterns, we evaluate hormones, we evaluate timing, because growth hormone is just not about just making kids taller. It's about treating the right child at the right time. And if you have questions about that, please, don't hesitate to reach out to us or call us for an appointment. So anything else that you would like to add, Dr. Waldman?
No, I think that was a really great point. And unfortunately, those questions come up more often than I want them to, with the growth plates already being closed, that bone age x ray already showing that the growth is done. Just like you said, you are not going to get more growth in height. You might get growth maybe in the nose or in the feet, but not in the height where you want it. And so, again, we feel very strongly that we do not prescribe for that indication. But just like you said, Dr. Mehra, we are more than happy to see patients who are worried about growth. Just because you come in doesn't mean you walk out with a growth hormone prescription, but you will walk out with an evaluation feeling confident about your child's growth and health and an explanation of what the next steps are and where we're going together.
Exactly. So if you have any further questions, please reach out to us. You can find us on our website, www.endokidsconcierge.com. I'm also on Instagram at Dr. Mehra, and we also have an Instagram page at Endo Kids Concierge. So please reach out to us and don't hesitate if you have any questions or concerns. Again, this podcast is for educational purposes. It is not meant as medical advice, but please reach out to us if you have any questions. Thank you.
Thank you so much for joining us on the Endo Kids Podcast. We hope you're leaving with a little more knowledge and a lot more confidence. If you have questions, stories, or topics you'd love us to cover, please send them our way. We love hearing from you. And don't forget to check out our website, www.endokidsconcierge.com, for free resources, guides, and more ways to connect. You're not alone on this journey. We're here to support you and your family every step of the way. If you enjoyed this episode, don't forget to subscribe to our podcast so you never miss an update.